New York is a bigger deal, but it's going to go also. But I have a feeling that a lot of the numbers that are being said in some areas are just bigger than they're going to be. I don't believe you need 40,000 or 30,000 ventilators. You know, you go into major hospitals sometimes, they'll have 2 ventilators, and now all of a sudden they're saying, can we order 30,000 ventilators?
So what you just heard there was Donald Trump just a few minutes ago on Sean Hannity on Fox News, basically arguing that what doctors, nurses, medical professionals, public health experts, scientists, and all the rest are asking for is over-exaggerated. That all of those people and their calls for things like ventilators is an over-exaggeration. That America doesn't need 30 or 40,000 ventilators. Most hospitals, Donald Trump says, only have a couple, so why do we need all of these extra ventilators now? And this shows a man who either doesn't give a damn about regular people, doesn't understand the severity of the crisis facing his country, maybe both at the same time. This was also part of an interview where Donald Trump said simultaneously that this crisis is really, really bad and a big challenge, but that we also just have to open up the country again. And he's saying these ridiculous things like, well, you know, maybe we can't just open up the country altogether, full stop, 100% right away, but there are parts of the country where this crisis hasn't hit. And maybe those parts of the country, he notes certain rural parts of the country away from the epicenters. And he's like, maybe those places can open up and get back to work. And then the rest of the country that's dealing with it can take a little bit of extra time. But that's not how this works. That's not how any of this works. Either with the ventilators or with the possibility of opening up quadrants, as he put it, of the country. Because the reality is that without a full shutdown, leaving only essential workers going to work, and without the necessary ventilators, lives will be needlessly lost for nothing. And Donald Trump is either unable or unwilling to accept and understand that fact. And that shows that he's really dangerous being in such a powerful position at this moment. Here's the reality, folks. The whole premise has been about flattening the curve, getting the cases of this particular crisis to come gradually so the healthcare system would not be overloaded. And one of the key overload points for this particular crisis is access to ventilators. Because you need room in the hospital, yes, you need beds, you need physical space to store people, to house people who are in crisis, but you need this particular equipment because the illness as it manifests affects people's ability to breathe. That's the chief damage doer of this particular crisis. Full stop. That's what does people in when we're talking about this issue. Simply put. And so, the more ventilators you have, the more likely people with severe instances will be to survive. In some countries that have more per capita ventilators than the United States, they've still had to triage ventilator usage, pick people more likely to survive, choices that no doctor, no nurse, no public health expert wants to make, should ever have to make, but emergencies happen and crises happen. And the United States can already see what has happened in places like Italy and China. And they should know that with lower per capita access to things like ventilators, they could face levels of triaging that are even more heart-wrenching, unless they do everything they can to get that equipment to the doctors, to the hospitals, to the locations that need them. Maybe the need for extra ventilators is not evenly spread across the country. Nonetheless, there are certain communities, places like New York, for instance, that definitely need more medical equipment. And I don't think doctors, nurses, public health officials are making an over ask. I don't think they're overestimating their need. And you have to say again, that if you buy a few more ventilators than you need, lives will be saved. If you buy a few less, You'll save a few bucks, but is that worth losing lives? I would say no. The implication is that Donald Trump is saying yes. And the reality about this quadrant system doesn't work. The United States has 50 individual states within it, but there's no strict border between any of them. You can close your national borders. For instance, Canada and the US have closed their border. But within each of the countries, you can't really restrict people's movements. There are certain freedoms people have, and in addition to that, there are certain logistical nightmares of building temporary borders between, say, Wisconsin and its neighboring states. It's just not feasible, right? It's not feasible in any meaningful way. And so if you want to quote unquote restart the economy in certain parts of, say, rural Texas, and you really honestly believe that because no one in that particular community has this particular crisis affecting them, that it won't still spread it, is ridiculous. If you start to restart the economy on regional bases, you will still inevitably connect that economic activity to areas that are affected, and it will prevent flattening the curve. And those places of America that currently are without cases, and that's great to see that there are some communities that haven't been affected. God bless them. I hope there were more communities like that. I wish there were. But if we want those communities to stay unaffected, they need to be practicing social distancing, closing down non-essential economic activity, asking people as much as is possible to stay home. Donald Trump is putting stock markets, he's putting this idea that he's trying to get a good deal for the taxpayer, whatever that means, ahead of the reality that people need this crucial support and that social distancing is essential to save lives and to mitigate harm and suffering and sadness for the American people. So it's in these moments, guys, where you see that the president is ill-equipped, and even if he had the equipment to do it, he would ignore, the brain in his head telling him the factual knowledge. Donald Trump, in a way no other world leader, except for maybe Bolsonaro, is basically flouting the scientific evidence that's being given to him. Here in Canada, I've been very critical of Trudeau's response, and there are conservative governments in Europe that I would never vote for, but most of them, at least somewhat, are getting information from doctors and nurses and public health officials, and they're generally interpreting that into policy. And yet we see with Donald Trump, when we also talk to folks like Dr. Anthony Fauci and other public health officials at the state and local and national level, who are giving us very clear guidelines that we need more ventilators, and we can't open up the country for weeks and weeks and weeks. Easter is not a possibility. Donald Trump is saying, well, if you listen to the doctors, they'll tell me I'm wrong, but I feel we need to move forward anyway. That is a man flouting basic scientific knowledge and advice. And that means he's a terrible leader who's putting Americans at risk. It's unacceptable. The American people deserve better. But as it stands right now with Donald Trump in power, I don't know if they'll get what they deserve. And it's really sad to see.